Greetings and welcome to In-Depth. I'm Dike Rostant. Cataracts are the leading cause of blindness globally, and consultant ophthalmologist Dr. Ronnie Bhola, he joins us on the heels of Cataract Awareness Month to highlight the economic impact of cataract surgeries. And with that, we welcome you, Dr. Bhola. Thank you so much for making the time. And I want to start off, though, asking how prevalent are cataracts, we say, in the Caribbean compared to other regions?
So the prevalence of cataract surgery in this region is around 30%, and it is one of the top three causes of blindness in the region. The interesting thing about cataracts, it's reversible blindness. So it is one of the ocular conditions that we target when we're trying to transform our country's blindness level. In the world, cataract is probably the leading cause of reversible blindness. And in the Caribbean region, we do have a high incidence of cataract leading to blindness because we think sunlight induces cataract development.
But looking at the fact that you say it's reversible, but you may want to have more people go through or reverse this process. Is it a matter? What are some of the reasons that people don't have cataract surgery, Dr. Bhola?
The main reason, actually, cataracts are easy to diagnose because obviously people complain of reduced vision, things like glare. So it really bothers them. And then they come in and see an eye care professional, an optometrist, or an ophthalmologist, and they get diagnosed as having a cataract. The main stumbling block from patients having the diagnosis is really the surgery or the intervention. And that's where we need to focus our attention to try to alleviate blindness from cataract. Because the solution is a 15-minute surgery, and the economics of, of reducing blindness from cataracts is very good. It's a low-cost intervention and a high-benefit intervention economically for our country, for our society, for our government to invest.
You say 15 minutes, but it is really a thing because I have a grandmother who, it wasn't cataracts, but she had another eye or issue. And looking at what it is a person is able to do, their sense of autonomy, being able to do things for themselves, to having to rely on people. What are some of the before and after that you get from persons? Because they actually took away her sewing machine when she started to sew by feel. But in terms of saying, okay, well, this person has a new lease on life after that 15 minutes, what are some of the things that you hear from patients in our clinic?
Yeah, it's one of the most amazing interventions that we see in our clinics because it restores not only vision as you realize, it restores life or lives. So it's life changing, the surgery. And what we hear in the clinics a lot is imagine some people get led in by a relative. And, I was in Antigua recently, and a brother was about 36 or 37, was leading his 32-year-old brother into the clinic, and because his brother was blind from cataracts. And when we did the surgery the next day, the brother who was blind, he walked off in, telling me he's going to start playing his football again. And he hadn't played or done anything for himself for over 2 years. The brother was taking him everywhere. So it's life changing for people. And imagine young people who have cataract at this young age. It affects their education, it affects their ability to work, to have a life. And you give people cataract, you give them the surgery, you give them the opportunity to develop a life. What about older people? They are dependent on others if they can't see. And when you do the surgery and you reverse that blindness, they're not only able to take care of themselves, but they become contributory to the family unit and adds a lot of value. So it really adds a lot of value socio-economically to a country to really alleviate blindness from cataract.
And you spoke about someone 32 having the procedure done after about 2 years of living with it. And that makes me want to ask about the timeline for cataracts developing. Is there a general timeline? Is it something that happens in the split, in the blink of an eye? What kind of timeline are we looking at, Dr. Bhola?
The majority of people who develop cataract are they age related. So it happens in your 70s and in your 80s. And that's the most common type of cataract, age related cataract. But we do have people below 50, for instance, diabetics get early cataracts, patients who are highly myopic, they tend to get early cataract. And then certain eye conditions like inflammatory eye disease and also things like trauma. So, patients who are younger usually have a secondary cause leading to the cataract. We actually sometimes see little babies who are born with cataract and they have congenital cataracts. And therefore, it doesn't spare any age group. And you could imagine if you have a child or a baby with cataract, this is urgent. We need to restore the vision pretty quickly.
And that makes me want to ask, do you have an estimate for the percentage of people with cataracts in Trinidad and Tobago? Because one of the contributing factors you spoke about, things like diabetes. I can't remember if you spoke about it or we saw it on the video, and especially looking at the fact that the Ministry of Health is trying to do work with regard to NCDs in Trinidad and Tobago, diabetes being one of them, well, one type of diabetes. So what's the estimate in terms of percentages of persons in Trinidad and Tobago with cataracts?
So the data on the patients who have or are suffering from cataract, one of the things that is very useful to know is something called the cataract surgical rate. So in Trinidad, we haven't calculated the cataract surgical rate. And if you don't know the cataract surgical rate, then you don't know the scale of the problem. So that is one of the things that we've been working with the Ministry of Health in trying to calculate in Trinidad, because one of the things you really need is data. Because if you're going to have an intervention, you want to know the effect of your intervention, and therefore you need to get the data, and you need to get the data as accurately as possible. In about 2014, there was the NEST study that looked at the prevalence of cataract surgery in Trinidad, but we're in 2023 now. So we really don't want to be using 2014 data. And they didn't calculate the cataract surgical rate. They just gave an estimate of the blindness levels related to cataract surgery, which was round about 30% in Trinidad, which is pretty high.
And with that, we take a short break. We are speaking with consultant ophthalmologist Dr. Ronnie Bhola. We'll return with more. Stay with us. Welcome back. We are looking at reversible blindness, specifically cataracts, with consultant ophthalmologist Dr. Ronnie Bhola. And Dr. Bhola, in terms of the usual treatment for cataracts and saying that it is reversible. It takes about 15 minutes. Once again, I want to go back to the question, why don't we have more persons, one, possibly getting diagnosed, and then two, going through that 15 minutes? And what is it? Is it a matter of money? Because you said it's a low cost, but is it that people don't want to go through the procedure? What are some of the reasons that you get from where you sit?
Um, most people, they get diagnosed with having a cataract, and they have two options. One is they could go privately and have cataract surgery, or they could go into the public service and get cataract surgery. What's happened is because of COVID-19 and other factors, the waiting list for cataract surgeries have gone up. So public hospital waiting lists for cataract surgeries have gone up, and privately, it's out of the budget of quite a large number of patients to have cataract surgery. So what has happened in the United Kingdom in the National Health Service is that they have linked public and private to try and reduce backlogs of cataract surgeries in the National Health Service. And that's one of the solutions, possible solutions, that we could employ in Trinidad to try and reduce or alleviate the mounting blindness created by COVID-19.
What else do you think that it can be done? Because one of the reasons is that I asked the question is that it seems as though you make this solid link between rates of people having cataracts in a society and the impact that has on the economy. So draw that line for me a little more. Give me some examples, thanks.
So there was a study out of the US that showed cataract surgery is a low investment procedure with a high economic return for a society or a country. And it estimated that it is of the order of 4 to 5,000 in economic return. So it's really a no-brainer if somebody wants to invest in healthcare. That this is an area that you should be investing your healthcare dollars in to alleviate blindness from cataract, because it's going to improve the economic development of your country and your society. And really, it's our job as the healthcare professionals to make the decision makers aware of these facts so that they could make better decisions with our healthcare dollars.
And now the doctor I have in my name, Dr. Bhola, is my initials. So give me the easy procedure, please, in terms of like what takes place during that 15 minutes of the procedure, and also how long does someone need to stay in aftercare. You gave me the example in Antigua when the person left the day after, but take me through what goes on in that 15 minutes and how much longer the person needs to stay in the system. One, just staying there, possibly one or two checkups after. Take me through that process, thank you.
Yeah, so what a cataract is really a clouding of your natural lens. So the natural lens in the eye gets cloudy, and it blocks the light from coming through the eye to get to the back of the eye. So in cataract surgery, what we do is we remove the cloudy lens and we replace that cloudy lens by a transparent 100% transparent lens. It allows 100% of the light to come through, and it also focuses the light onto the back of the eye. So we also get you close to 20/20 vision if the health of the eye is very good. And it happens really very rapidly, because as soon as we do this surgery, within hours, which is usually 24 hours later, when you take the pad off, you notice, wow, I could see now. Before I was having this really cloudy vision and I was struggling, but now all of a sudden, yes, I could see. This is like a revelation, for a lot of people.
And is it a matter of doing one at a time if you have both, if you're affected in both eyes? Also thinking about the financial constraints that some people may be going through. Although you said that part of it with the public system sometimes is just getting that date. But do individuals do one at a time from time to time?
Well, we have been always in do one. We did one always at a time. But you bring up a good question. Is the economics of it really going to drive us to think? Well, we have this patient. They in the operating room. They have cataract in both eyes. Let's just do both eyes. We have them here already because the risk of cataract surgery is so low. We could really be thinking about doing both eyes, especially with the drivers we have now to try and get the cataract numbers, up to try and alleviate this blinding problem. However, it is still debatable whether we should do two eyes at one sitting or do one eye. Doctors tend to weigh on the side of caution, and we always have to be careful. And we still have been only doing one eye, and a week later we may do the other eye, or 2 weeks later we do the other eye. So we do the two eyes, but we do them a little bit close to each other so that both eyes could heal, together around the same time.
We have about 2 minutes more, Dr. Bhola. In terms of that, you spoke about public-private and that partnership to get levels of persons with cataracts down. What advice would you give to persons who have cataracts, and what more do you think can be done in terms of helping to reduce cataracts nationwide?
So the thing is, most people, if they have cataracts, they don't know if there's something else happening in the eyes that could be pretty serious. Because you'll experience things like reduced vision, like glare, like halos around lights. So if you have these symptoms, you really need to go and get your eyes checked, because if, let's say you're diabetic, you could be bleeding in the eyes. If you myopic, you could have a retinal detachment, something that could lead to blindness if not taken care of pretty quickly. So get your eyes checked is what I would say to anybody who notices reduction in their vision. And really, to try and sort this problem out, we really need to be influencing healthcare leaders, the regional health authority, people, the ministers, the ministry. We need to get these people engaged in forming these partnerships to try and reduce blindness from cataracts.
And we want to thank you so much, Consultant Ophthalmologist Dr. Ronnie Bhola, for giving us some insight into one of the things that we can do to take ownership back in our lives if we are suffering from cataracts. We want to thank you for the work that you're doing. This has been In Depth with me, Dike Rostant. On behalf of the entire news team, thank you so much for joining us.